Hello and welcome to Homeopathy Simply Explained. I'm a naturopath for classical homeopathy in Darmstadt, and today's video is about seminar part 7 with the topic of Post Vac part 3 again. I was asked by colleagues to present further Post Vac cases because these cases also pose certain challenges for us homeopaths, as we will hear in a case study today. Post Vac complaints, like post-COVID complaints, are usually systematic and affect the entire organism. In the last video about post-vac cases, we saw that allergy-like symptoms can occur with facial swelling, which we can also sometimes see in ME/CFS patients, the most severe form of long COVID, when they suffer from mast cell activation syndrome, but more on that in another video. In the last video, we saw from the facial swelling that the homeopathic medicines Rus toxicodendron and Okobaka can be used for such complaints. In today's video, we look again at a suspected post-vac case. As always, I will first give you an overview of what to expect today. Today we are talking about a case that I have been treating for a long time with pain in the musculoskeletal system, gastrointestinal complaints, facial swelling, recurrent with skin cancer, a chronic therapy resistant E-coli urinary tract infection, and syncope with elevated D-dimers. If you would like to support my work, you can find my PayPal account linked under the video or spread the word about the possibilities of homeopathy with a thumbs up or a comment under the video. Now I hope you enjoyed today's seminar. The patient I would like to introduce today is a patient who have been treating for a long time due to chronic pyelonephritis. The kidney inflammation had been in remission for a few years thanks to homeopathic treatment. I have already presented the case to you and will link it to you under the video. Most recently, the patient was on the homeopathic medicine calcium carbonicum, which helped her with various complaints. I will link the case to you under this part of the seminar, but will also work on it again as a seminar. Due to the risk assessment, the patient decided to have a vaccination with BioNTech. After the first vaccination, which took place on July 11th, 2021, the patient complained on July 24, 2021 of mild back pain in the kidney area and constant fatigue. Inflammation and bacteria were found in the urine. On July 26, 2021, the patient woke up in the night because she suddenly felt stomach contents in her mouth. Over the time, the patient became so tired that she only slept. The patient had shortness of breath and the feeling that her chest was too tight with pain when clearing her throat on coughing. On August 23, 2021, the patient received the second vaccination. The tiredness was still present in this time. The following night, the patient could no longer sleep due to muscle pain and could hardly turn over in bed. Breathing was only possible shallowly. In addition, there was an unusual urine containing bacteria and leukocytes and very severe pain in the hip joints, so that the patient could not lie on her side. The pain in the musculoskeletal system was the reason why the patient contacted me on September 4th, 2021. She had had a restless night. Her legs felt like they were in tight boots. Rubbing her legs brought some calm so that she could sleep in 2-hour intervals until 9 a.m. She has to use a cushion to sit on her bottom so that she can sit with minimal pain. It feels as if she has been on a horseback ride. Her kidneys were pain-free and there was no pain when urinating. A strange symptom occurred one day after the second vaccination. The patient had undergone surgery on her left hand due to carpal tunnel syndrome. Her thumb on that side now felt as if it had been broken and was in pain well into the night. Even a higher potency of calcium carbonicum did not help the symptoms. I repertorized and took all the modalities she told me. Here we see the repertorization with the categories extremity pain, hip sitting aggravates, general rubbing ameliorates, general lying on the side aggravates, chest pain cuff aggravates, general pain broken leg, general pain movement aggravates, and general breathing aggravates. We see calcium carbonicum in first place, which, as already mentioned, did not help, and arnica montana in second place. The patient was given arnica C200, which helped her sleep better and made the pain in her legs, buttocks, and hips disappear within 2 days. With arnica, as is known from the homeopathic medicine cabinet, we find problems in the bone, muscle area, which can be very painful. The limbs feel bruised and there can be a bruising sensation in the pelvic region. Bone inflammation or thrombosis can also be found in the drug picture of arnica montana. Arnica can also be used in cases of shock. We remember my theory on ME/CFS, the most severe form of long COVID and subacute distributive shock. You can find the video linked under the seminar section. During an upcoming blood test, I had the patient's D-dimers determined. D-dimers are the decomposition products of blood clots. At this point, it was already known what side effects the vaccination can cause, and I wanted to make sure that my patient was not affected by this side effect. Here on the top right, we can see the blood values after the second vaccination on September 1st, 2021, with a D-dimer level of 287, which was completely within the normal range. From September 7th, 2021, the patient noticed severe hair loss, and since September 9th, 2021, stomach pain occurred after eating, which lasted for 20 to 30 minutes. Then she has a bowel movement and the stomach pains disappeared. The patient had no appetite and had to burp after eating and had a bloated stomach. Bowel's movement then started 1 to 2 hours after eating with a contraction like evacuation. Then it got better until the next meal. On September 16, 2021, a pretty severe herpes appeared on the lower lip and the urine was more noticeable again, which is why I switched back to calcium carbonicum and recommended taking D-mannose to be on the safe side. D-mannose is a sugar that is made from birch, beech or corn and ensures that the bacteria cannot attach themselves to the bladder wall. The patient tried antibiotic therapy for the second time until September 18, 2021. The stomach pain then disappeared. On the third day, the problems with the extremities reappeared, with the body feeling as if it were trapped in a corset, and she felt sick when sitting. 2 days later, on September 21st, 2021, the stomach was not bloated for the first time after breakfast. An ultrasound examination showed that the kidneys had suddenly shrunk in size compared to the previous findings. A urine culture revealed E-coli bacteria. After taking the antibiotic, the patient felt lacking energy and muscle pain returned throughout her body. Unfortunately, the antibiotic did not help in the long term. I assume that the patient keeps getting reinfected due to her weakened immune system and thus could not get out of the continuous cycle. The patient refused to take any more antibiotics. And the patient suffered another severe relapse with nighttime vomiting and the already familiar hip pain that prevented her from lying on her side. I went back to Arnica, which again gave the patient better nights and relieved the hip pain. I then started another E. coli nosode at C200 on October 25th, 2021, whereupon the patient called me the next day full of enthusiasm. She had slept through the night for the first time in a long time and her tiredness was at a tolerable level. It is quoted as saying, like a small miracle. On October 27th, 2021, the patient reported that she was still sleeping well and that there was no more pain. She felt like she was getting energy again. The E. coli nosode seemed to keep the bacteria somewhat in check, but did not make them disappear permanently. Here, for example, we see another urine sample from November 20, 2021, in which bacteria were still present. The year 2022 went relatively well. One could also consider trying a lower potency of the E. coli nosode, such as D6. On March 7, 2023, the white skin cancer that had already been removed a year ago reappeared. On March 23, 2023, the entire legs felt like they were in a boot again. The feet, hands and fingers were swollen, the back hurt, and there was again shortness of breath and brief palpitations. A burning pain appeared when urinating and the patient had cold-like symptoms. We are not discussing the repertorization here because the focus here is primarily of the potential side effects and their treatment. These complaints were typical for the patient because we already knew them from the past and could also be treated well with the normal homeopathic medicine. The patient had now received the third vaccination again with BioNTech. Shortly after this vaccination, herpes appeared again on the lower lip, and the patient sent me this video on September 4th, 2023. I have now omitted the sound and quoted what the patient said. I am exhausted. My stomach is about to burst. I have a pressure up here that is not normal. I don't know if I can tell the doctor tomorrow, but doing nothing is fatal, I think. Everything is about to burst. I've never experienced anything like that before. End of quote. Patient had pressing pains in the rib cage towards the breastbone. After eating little, her stomach swells up like in the 9th month of pregnancy. There is a pressure like a heavy weight. a hot water bottle on the upper abdomen helps. The patient cannot lie down or sit, which is why she is constantly walking back and forth. She vomited from 11 p.m. to 1:30 a.m. Yellow bile with white foam came out and the patient was covered in cold sweats. She had pain all over her body like sore muscles. Swallowing was also painful and it felt as if someone was grabbing her by the throat and squeezing her. The nightly vomiting had been going on for several days and the patient had already packed her bag for the hospital. As long as she doesn't eat anything, she is fine, and drinking is also very painful. There are still bacteria in her urine. Let's look at the repertorization. We have stomach pain pressing, abdomen pain bursting, abdomen bloating after eating aggravates, general movement ameliorates, abdomen pain warmth general night, stomach vomiting type of bile, sweat cold, inner throat pain, swallowing aggravates, and inner throat constriction. We see 5 remedies that cover all complaints. We already discussed Carbo vegetabilis and Bryonia in the last video, and if you can remember, Carbo vegetabilis has the symptom that as soon as the food gets into the stomach, it starts to ferment and the stomach bloats as a result. See exactly this phenomenon in this patient. So I started Carbo vegetabilis, the vomiting stopped and the patient was able to sleep. 2 days later, on September 6th, 2023, the face and décolleté swelled. It itched and was red. The pain felt weak again and her eyes burned. Herpes also reappeared. These symptoms disappeared again with Carbo vegetabilis. On September 23, 2023, the patient's health situation worsened further. She was on her way into town on her bike to go shopping. When she arrived at the store, she suddenly felt dizzy. Everything was spinning in circles. She was given a glass of water, and when she felt a little better, she went home. At this point, there was an aversion to meat. The patient was not hungry. If she did crave anything, it was oatmeal with milk, which she hadn't liked so much before. In the evening, her feet were ice cold. On September 24th, 2023, she came up the stairs from the basement and her neck was drenched in sweat. When she go to the top, according to her husband, she rolled her eyes and collapsed unconscious. Before that, she reported she could no longer feel her feet. When the patient regained consciousness, she was very tired. Her blood pressure was within the normal range. Her hands were cold and the patient was shivering. She also had abdominal pain in her lower abdomen. At this point, the patient was taking her constitutional remedy, calcium carbonicum, again. When the patient told me about this event, I sent her to the doctor for clarification with the instruction that the D-dimers should be checked in the blood test. Unfortunately, the familiar doctor refused to check the D-dimers and sent the patient home with a diagnosis of gastritis and a medication. I sent the patient to the laboratory I work with on the same day, which was now September 28, 2023. It turned out that the D-dimers were drastically increased at 1393, which is why the laboratory called me to tell me this. The patient went to the family doctor with the lab results that same day, who gave her an urgent referral for a CT scan with the suspicion of a pulmonary embolism. Fortunately, the CT results we see here did not show a pulmonary embolism, but showed slight central congestions above the lungs, which could possibly be related to the heart. Mild pulmonary emphysema with scarring of the lungs was also found. A protrusion of the aorta was also seen. The patient was supposed to see a cardiologist with this finding, which she then did. Let's look at the repertorization. I took the categories dizziness, spinning, feeling like everything is spinning in circles, mind unconsciousness, extremities numbness, feet coldness, extremities cold feet in the evening, general food and drink, meat aversion, general climbing stairs, extremities cold hands, frost shivering, general aneurysm, and chest emphysema. I gave the patient carbo vegetabilis again. One of the cardiologist's first question was whether she had been vaccinated, to which the patient replied in the affirmative. The cardiologist said, quote, "Well, then you know where you got it from," end of quote. This is exactly the same statement that another cardiologist gave to a friend who also only suffered from heart problems after the vaccinations. My patient was supposed to undergo further tests, but she refused and has unfortunately not followed up on them to this day despite my advice. Blood test from September 29, 2023, the result of which you can see here, showed a reduced interferon gamma value, which indicates that the cellular immune competence is reduced or that there is a decompensation due to the chronic inflammatory process. Interferon gamma has an antiviral and anti-tumor effect, which also fits with the recurring white skin cancer. In addition, the blood count showed a systemic inflammatory reaction, which we have already heard from the symptoms, but which is shown in the TNF-alpha and interleukin-6 values. The naive T cells are therefore present in increased numbers, which we find in certain autoimmune diseases, leukemic T-cell lymphomas, and certain infectious diseases such as shingles. The T memory cells are slightly reduced so that the immune system no longer remembers previous illnesses as well, and the patient can more easily get known illnesses again, as we see with the E-coli urinary tract infection. As we can see from this case study, patients who are very well adjusted to homeopathy can suddenly experience health problems. The constitutional remedy calcium carbonicum was no longer effective for various complaints, and already known weak points such as the kidneys with chronic pyelonephritis, the stomach with the hiatus hernia, the thumb with the carpal tunnel operation were triggered. But as we can also see, the constitutional level keeps coming through, so that calcium carbonicum had to be used again and again. The interim remedy arnica also had to be used twice for the bone and muscle pain. For such patients, we sometimes have to throw our original homeopathic way of thinking overboard and look for unusual treatment approaches, as we saw with the E. coli nosode. In addition, these patients usually need a homeopathic remedy that has a positive effect on the blood and blood vessels, such as carbo vegetabilis in this case, which the patient is still taking today. With ME/CFS patients, I have found that administering several homeopathic medicines at the same time leads to better results. For this patient, I gave the medications individually. The question arises whether simultaneous administration of calcium, arnica, E. coli and carbo vegetabilis could have prevented the syncope and the patient would have fared better. The problem with these cases is that something can happen in the cells that we cannot see, but which, as we can see in this case, sometimes becomes apparent through a certain group of symptoms. In this case, it is the patient's central congestion symptoms with the increased D-dimers, which first appeared with the symptom complex of the bloated stomach and for which the patient needed carbo vegetabilis. The problem is that the congestion in the vascular system does not disappear so quickly, which was shown again by the symptoms of syncope, for which carbo vegetabilis was used again. Hahnemann writes in the Organon, paragraph 40, the new disease, after a long influence on the organism, finally joins the old dissimilar disease and forms a complicated disease with it. As two dissimilar diseases, they cannot cancel each other out or heal each other. End of quote. We have this phenomenon when a miasma is grafted onto our constitutional level. Two dissimilar diseases then exist side by side. From time to time, the miasma shows itself with its symptom complex and requires separate treatment before we can deal with the constitution again. In some Post Vac patients, however, I think that a third level has been added to the two levels of constitution and miasma, which, however, does not fade into the background like the miasma and pops up from time to time, but can then be soothed again by homeopathic treatment, but that this third level is permanently present, sometimes symptomatic, sometimes asymptomatic, and requires permanent treatment. This is something that we will have to observe and discuss in the future. In homeopathy too. In homeopathy too, experience must be gained on these topics and treatment concepts developed. If you want to remind yourself how the vaccination works exactly, you can watch the corona vaccination video. I'll link it under this part of the seminar. It's essential to develop an understanding of the problem so that you can adapt treatment to it. I know that prescribing several drugs at the same time is an unusual approach. However, based on the patient case of the transition to long COVID, we have already seen such a treatment with success, and we will look at examples of ME/CFS patients for whom this approach has also proven successful. I hope you got some added value from this part of the seminar. Don't forget to subscribe to the channel and give it a thumb up. Until then, bye!